I'm Dr. Bernie Chinnasamy, Medical Director and founder of Cancer GPS. I have a message for patients affected by cancer and for their loved ones. In this unprecedented time of the COVID-19 pandemic, what do we know about COVID-19 and cancer? Our limited information comes from China, from all the hospitalized patients, where a very tiny fraction of the patients happen to be cancer patients. So, what do we know? 1. We know older people did worse than younger people. 2. We know smokers did worse than non-smokers. 3. We do know men did worse than women. And finally, lung cancer patients had the hardest time. So, what can we do about this? Personally, we talk about social distancing. They talk about 6 feet. That is a minimum, not a maximum, and is important. Washing your hands is extraordinarily important. Keeping away from crowds and keeping sick people away are also other measures that are very important. Reporting if you have a fever is important as well. So, I would like to add one more thing, is that certain COVID-19 infected patients are asymptomatic and look completely healthy. But they can still infect a lot of people. So my recommendation is stay away from anybody you don't need to be meeting as much as possible. Hospitals have also stepped up their game. 1. They have banned visitors except under extraordinary circumstances. 2. They've cancelled cases that are elective to keep crowds down at the hospital. 3. They're even checking people's temperature when they come into the hospital. The world has responded to this pandemic as well, even countries going so far as to shutting down the whole country. This is serious and we all need to take it that way. This is for all our protection and not to inconvenience anybody. What treatments do we have available for COVID-19? Unfortunately, there are no specific treatments. It is supportive care to get patients through. One extreme is patients are completely asymptomatic and need no care, and the other extreme is people need to have ventilators for life support. Why should we be hopeful? We should be hopeful because the world has come together. The virus's genome has been sequenced and we are working on vaccines. We are also working on other medications that have previously been used in other diseases to see if they will be useful in this viral outbreak. We also know that we have some of the finest minds like Dr. Anthony Fauci working on this. For those of you who do not know Dr. Fauci, he is to infectious disease as Steve Jobs was to the smartphone. So, is there a silver lining to this? I would like to think so. 1. We understand again life is precious. Our ultra-fast lifestyle has come to a grinding halt. So let's take a moment to enjoy our family and loved ones before we get back on this treadmill. We have also know that we need each other, very importantly. I know some of us are afraid, but cancer patients are among the most courageous people I know. Because courage is not the absence of fear, but our ability to overcome it. And we are a courageous people. God bless and thank you.